So it is National Wear Red Day, and you know this guy, it's Thumper, but you also know this guy. We are ramping it up this year. We have Jackson DeVille, who looks so spiffy in his red. Don't get these things in your mouth, because that is not comfortable. But you are showing out today, getting everybody to honk for heart, because it is all about raising awareness for women and heart disease. I want to introduce you to this woman. Her name is Joyce Seiler, and you are a heart survivor. You had an incident that she believes had been plaguing her since you were in your 20s.
Yes.
Tell me about what it felt like.
Well, there was some chest pain, a lot of racing of the heart, and really the irregular heartbeat is what was getting my attention the most. So when it would do that, I would get lightheaded and feel dizzy. I'd have to lay down, and then closer to the time when I had the ablation is when I was laying down for 4 or 5 hours a day because I couldn't do anything else. I had to wait for it to pass.
And what condition did you have?
I had atrial fibrillation.
And that's something that is definitely a risk for women, and it could increase your chances for having a stroke. So you decided to have the ablation. You were out of the hospital the next day. Tell me how you're feeling.
I feel fantastic, and you know, Baptist Heart rocks. So I'm just thankful to be here, and you know.
Enjoy. That's why you did it, because you wanted to be here for all your grandkids. You have 8 grandkids?
Grandkids. I have 8 grandkids and 1 on the way.
Wow. All right, so you're going to be here a long time,
busy.
keeping that heart healthy. And that's what this message is all about, to raise awareness of a disease that kills more women than anything out there. And this is the 11th year for National Wear Red Day, and it's certainly upping the ante, raising attention for this disease. Joining me now, we have Dr. Pamela Rama, who is the president of the board for the American Heart Association, and very excited to have you be a part of that, because you are a champion for women and heart disease. What do events like this do for raising awareness?
I think it really needs to be out there that, you know, women need to know that heart disease is our #1 killer.
Well, we are a little more than 2 weeks away from our Take It to Heart Day. We are gearing up, so excited about it. Blood pressure, cholesterol, glucose test will all be performed for free, and you will also find out your body mass index. Here's some video from last year. You can actually meet with a doctor or a dietitian to get some advice and resources to improve those numbers. They are all so important to your heart health, and in past years, those numbers have potentially saved some lives. So we hope that you will be there. 2 ladies that I know will be there. These 2 sisters here. We have Arletha and Arlene. Appreciate you ladies coming in. You know, you get them talking about what you all have been through, and it's such a blessing, and you're healthy now. But talk about what happened to you 4 years ago. Since then, she's had a stent, but at first, you had these symptoms that you kind of chalked up to acid reflux.
I did, because I thought it was acid reflux, because my mouth would water, I was nauseated, and I just thought that, oh, I must be having indigestion, because it was like signs of indigestion.
Right.
And I was just nauseated, and my chest would just feel like it was burning. And I called my doctor, and I iced him. I said, you know, I need to come in, because I think, you know, I need to increase my reflux medication. He said no, and then that's when he said, I think you need to see a heart doctor. I was like, a heart doctor?
You didn't even think about it. And you have been dealing with those symptoms for many months.
For a long time,
So finally, he said, get in here.
Yes.
And they found that you had an artery that was 85% blocked. And you got in that next day, and you got a stent.
I had to have a stent.
And tell me what you've done since then.
Since then, I've been having my cholesterol checked. I've been following a better diet.
Since you lost 30 pounds?
I lost more than 30 pounds.
More than 30
I
pounds.
lost about 35 pounds. And
Congratulations.
I have, and I've been really watching my diet.
Right.
Exercising, not a lot of exercise, just walking.
Yeah.
Walking.
And that's all they say. You know, they even say 10 minutes a day is really all you need to do. If you could do more, obviously do more. Don't forget, our Take It to Heart event is March 31st at the Jacksonville Fairgrounds. There will be those screenings provided by Baker Gilmore, Memorial Hospital, Walgreens. We're also giving out T-shirts this year. We have a lot of new things going on as well. So go to our website, Take It to Heart. It's on the campaign on newsforjax.com. A lot of us do a lot of sitting. Those sedentary lifestyles can lead to death. So joining me now to get us up, or actually to sit down and exercise, which is actually kind of cool. We have Mark Murray, an exercise specialist from Memorial Hospital, and thanks for coming in today. All right, so our Take It to Heart event, usually, you know, we have the tests. Those are gonna happen every single year, but this time, we're gonna teach people kind of how to stretch. And for someone who might have had a heart condition or is worried about their blood pressure, cholesterol, this is a way to exercise and also feel a little safe while doing it.
That's right. So we're just going to demonstrate a couple basic exercises, and you can do it at home. We'll go from our neck to our shoulders.
Okay. And what does stretching do for us?
The stretching is good because it helps with our range of motion and our flexibility. And we all need to improve on those. And as we age, osteoporosis sometimes can set in, so we need to improve those areas.
And the more limber we are, the less likely we'll have an injury.
The basic one we could do is with our neck.
Okay.
Just want to place your hand up on top of your head. I'm just going to bring the neck. You want to be very careful with the neck muscles. Bring the neck over to the side. You're going to hold it for about 15 to 20 seconds.
Okay, and then?
And then release, and then back to the other side.
All right, and you want to do this how many times, how many reps?
You probably could just do it 2 or 3 times, like I said, 15 to 20 seconds of each one.
Actually feels really good. There is something different today designed to give you some healthy eating choices. We are adding this in, rolling it into the Take It to Heart event, and I am so excited about this element. It's a farmer's market. And one of the people who will be there, Florence Harridan, the founder of Conscious Eats. An amazing story of who you once were, who you are now, how you did it. And all I want to do is just put this up, guys, okay? So you see her now, and you can't really see full body, but we'll show you a picture in a minute. But this used to be her dress. This, and she said, and what did she say?
I was
You were stuffed in?
sausage into this. Sausage.
Can you imagine? And now look at you. Amazing. And we actually have a picture, Sharon, if we can put that up, of you before. Do you know this lady?
Not anymore.
Not anymore.
You know, it's like one of those things when I look back at how my life was and how crazy it was.
And it's changed so much.
And the thing that it has given me is compassion and to help other people go through that. I had been obese pretty much my whole life and found food, and it was sort of my drug of choice. I mean, that's really the only way to say it. But when I got to the place that I was sick of being sick of it,
you knew it was over.
You know, just had this major expansive moment in my life and had to figure out, like, how was I going to change everything?
We know the correlation between heart disease and body mass index is very key. So Raylene Schreimer, did I get that right? Schreimer, thank you. I like to pronounce people's names right. A dietitian at Memorial Hospital joining us now. A beautiful setup, and honestly, just looking at this, it makes you want to eat healthy.
Oh, yes. This is all straight from my fridge.
Your fridge. And I called her, I said, where'd you get this? She's like, my fridge, which really goes to show that, you know, you eat healthy, you practice what you preach, but it's easier said than done sometimes.
Yes, and I really wanted to focus on bringing fruits and vegetables today because that's what we want to focus our meals around. However, we want to include protein and carbohydrates like pasta and rice, but we really want to make sure that we're getting enough fruits and vegetables so we can get the vitamins and minerals our bodies need.
Okay, so that's the plate, you know, where before we might have focused our protein like maybe half of it or 3/4. We don't want to do that. You know, the idea here is to make that protein a fourth and the grains the other fourth, but then mix in fruits or vegetables. You know, we try to get people to come to this event, you know, realizing that there are tests, obviously, that give you results, that you can get good information that will tell you about the health of your heart, but also those relationships, those connections that you can make. Because as you saw, Dr. Baker really cared about you. Because he kind of got through the T-shirt, you know, and then talked about your heart.
Yes, because he was the type of person who related to me as a person, not as him being a professional as he was, which he was a cardiologist. And I didn't even know that at the time. So he spoke to me. And the way he spoke to me, it touched my heart.
Yeah,
and it
literally.
Literally.
Yeah.
And it made me realize that I needed to be serious about getting a cardiologist.
Right now, our Take It to Heart event is underway.
But let me kind of take you through the stations that you will get to see when you do come to Take It to Heart. So this is the blood pressure station. And these are things that might be difficult for you to interpret. So that's why we have doctors here. We have added so many new elements this year, and here is one of them. This is one of the stretching classes that will be taking place every 45 minutes today until about noon. Joining me now, I have Maria, who has actually come to Take It to Heart before. This year you're back, and you brought your friend because her blood pressure, you know, she was having some problems, wasn't feeling well, and where is she now?
She's on her way to the hospital. The EMT had to take her. They're transporting her, so I'm not able to even finish my session.
We have video of her actually being wheeled away into the ambulance where these guys actually stabilized her, and then she eventually did go to the hospital because her blood pressure was so high. Chris, this is the second person that you guys have seen today, and the first woman you guys wanted to take, but she wouldn't let you. Talk to me about why it is so important that when the blood pressure is raised to that level that they do need to get emergency care.
Well, high blood pressure is indicative of a stroke, and it can also cause other things like a heart attack.
We are live this morning at our Take It to Heart Day at the fairgrounds, and we are packed, inviting you to take this opportunity to find out very important health screenings specifically about your heart. And I want to show you the line. Larry Rogers' wife is inside the ambulance. her blood pressure was dangerously high.
She was insisting on coming out here. I wasn't, but she decided she wanted to come on out and get her, pressure and other things checked out, and it was a good thing to do that.
And then there's Paul Whiteman, who also knew he had some health issues.
And I saw you this morning, and I said, I could barely drive down here, but I drove down here.
His blood pressure was also high, and he got taken straight to the emergency room.
I feel like I'm on the way to be taken care of. Thank you.
Valerie King is another patient who went inside the ambulance to get an EKG. She doesn't have insurance, and that has been the barrier to getting care. But now she knows she cannot ignore her high blood pressure.
Definitely a hospital visit, just to have it checked and monitored. And to get on some type of steady medication.
Dr. Baker with Baker Gilmore Cardiovascular Institute thought up this event more than 10 years ago. He says every year he's surprised by the amount of people whose lives are changed just by these screenings.
Every time I think we've touched everybody in town, I get fooled like a day like today, where the outpouring is just tremendous. And sick people, and again, without always the means to get care.
And then we have people who come every single year and their results are good and they keep on coming.
I have 2010, 11, 12, 13, 14, and this year.
And this year, the new additions were a big hit. Stretching sessions inside, and then on the outside, this wonderful farmers market where people were able to come and buy some healthy items that will get them on the next step to taking control of their health. And apparently, they even sold out of these veggies. So we say a big thank you to you and a huge success, and we'll see you next year. Melanie Lawson, Channel 4, the local station.
So you were very encouraged by the outcome today, or the number of people who turned out?
I'm always surprised, and we had about 20% increase from last year. We added some wonderful new things to keep it fresh, and people seem to respond to what we're trying to do. It just shows what the needs are.
One story that I thought was really particularly touching, there were so many people who came up to us, is there was sisters, and their father had passed 4 months to the day yesterday. And the way that they decided to spend the time together is to go and make sure that they're taking care of their health.
Awesome.
Isn't that fantastic? They're from Southeast Georgia.
Yeah, there's stories
awesome.
like that all over. Family members who make this appointment, they do it every single year. And it is so touching to see the people that say, you guys told us to come, so we came. Right.
Heart disease is the #1 killer of both men and women in the U.S. It's a statistic you hear a lot about here on Channel 4 because we are committed to helping you know your risk and make changes to improve your heart health.
And it affects us quite honestly directly. I mean, this guy sitting next to me has had 2 heart scares in just 2 years. And you scared us all, quite frankly.
Scared me.
Melody has more on Bruce's surgery and the warning signs that, well, you said you just couldn't ignore.
First off, we do want to say Bruce is fine. He had a surgery and he's doing well, but you see him every day delivering the news with flair, always has a corny pun when appropriate and sometimes when it's not, honestly. But a couple weeks ago, he was missing in action. Bruce listened to his body, wound up in the operating room. It was the second time in 2 years. Bruce's heart was talking and he listened.
So I find myself back here at Memorial Hospital. I was here actually almost exactly 2 years ago. There'd been a 98% blockage in the artery they call the Widowmaker. And Dr. Ashi went in and gave me a stent and basically saved my life. Well, recently I've suffered some chest pain, shortness of breath.
It was the same artery causing very similar symptoms 2 years later. Bruce knew he couldn't ignore them this time either.
I have a history of heart disease in my family. Both my grandfathers died when they were not much older than I. And I guess my best advice is to not ignore the warning symptoms. Guys have a tendency to not to want to go to the doctor. Go, because it could really save your life.
Also, developing a relationship with your doctor could be life-saving. Interventional cardiologist Dr. Majdi Ashi knows Bruce's heart better than anyone else. He did his first surgery and performed the stress test this time that showed there might be another abnormality.
But we're going to do something called an intravascular ultrasound, which is basically looking at the artery from inside, as if you're driving in a tunnel, to see if there is any blockages at all.
Back in the operating room for a different surgery, more exploratory this time, to see if the blockage was severe.
We were concerned that there's a blockage, a serious blockage.
Dr. Ashi was ready to clear that blockage if necessary.
We concentrated our investigation to this here, and we found that he has only minimal blockage, actually less than 10–15%.
It was minimal, and this time, Bruce did not need a stent. Dr. Ashi was finished, but Bruce's work was just beginning. He needs to make some changes so he doesn't end up back in the OR.
It was very easy to tolerate. I'm very glad that we went ahead with this diagnostic. The blockage is not what we thought it was going to be, but I think the signal to me is to probably go ahead and adopt some lifestyle changes so that, frankly, no offense, I don't have to wind up back here.
And of course, he's telling jokes through the entire surgery, you know, because you were awake and you were able to be a part of it. But, you know, I wanted to do the story, Bruce, because, you know, we were at the Take It to Heart event and we saw hundreds of people who do not listen to those symptoms. And so we're all happy that you did. You have committed, though, reluctantly.
You heard him saying probably and may, but he is going to because these two ladies did right here.
Yeah, they've been twisting my arm. So I do have to change my dietary habits. And I'm going to exercise more. I'm going to try and get more sleep, though it doesn't help being on this schedule.
Yeah, but
at least you guys confirmed I have a heart.
Well, we know you have a heart. We've known that for a long time, even though it might be small. It's there. But, you know,
what do I have to do?
Okay, so we're going to talk a little bit about this because you are definitely going to make this commitment for a month, and we're holding you to it. A few things that Bruce is going to do. And if you'd like to take this challenge with him as well, he will be posting on social media, also on newsforjax.com, this journey that he is going to take us all
We're giggling about this because, I know, you were twisting his arm on Friday. I know,
well,
that was right there.
You make a commitment here on air, and you really have to hold to it. And honestly, Bruce, it's what you need, and it's going to be good for you. So here it goes. All right, let's pull up this graphic because we want to share with everyone what you'll be doing. So exercising for at least 30 minutes, 5 days a week. That's a small commitment. You can do that. Walk on the beach. Take Marley on the beach, 30 minutes, get that heart rate going. Also, very simple. We're going to make sure that you are drinking water. You have to increase your water consumption. And also 8 hours of sleep per night.
Which probably is going to be the most challenging.
I think it is hard with our schedule. So, you know, there's some give and take here. You know, 8 hours may not work in one swoop of sleep, but maybe you get a nap, you know, at your desk on occasion or something. All right, so coming up at 8 o'clock, we actually have Dr. Ashi who's going to come in, talk more about your procedure. We didn't really delve into that much because I think also what was interesting about this is it was a pretty easy procedure.
Well, yeah, you know, like you said, this isn't about me, and I really don't want it to be. I just wanted to let you know that you've got to, especially guys, you know, I'm not going to the doctor. It's nothing. You've got to listen to your body because it could be something. The first go-round it was. This time I was lucky.
Okay, so
Next
Dr.
time
Ashi,
I may not be unless I, you know,
we're not going to have you in there again.
No chips and no pizza in the morning.
Or jelly beans.
Starting
or jelly beans
Wednesday?
or Twizzlers.
We'll see how this goes. Go on the journey with us, and again at 8:15 we'll hear from Bruce's doctor. Well, last hour, we did a story about our own Bruce Hamilton's second health scare in 2 years. Had to do with his heart. He had a procedure after having chest pain, rapid heart rate, and it was the second again in just 2 years. The first time he needed a stent in a major artery. This time that blockage was only about 10 to 15%, so his doctor did not have to open that artery up. But Dr. Majdi Ashi is here with First Coast Heart and Vascular to talk more about this procedure. And, you know, first off, we want to say we did the story, Dr. Ashi, because a lot of people can probably relate to this. They have those symptoms. Some of them ignore them, which we have always said is extremely dangerous.
Absolutely, it's dangerous to ignore it. I would rather you come in, get checked out, and leave rather than ignore it because 68% of the people roughly, you know, get a heart attack without any preceding symptoms. So it's very important to come and get checked out and, you know, leave, you know, safely.
Right, and, you know, we have to say 2 years ago, Bruce had a stent. He had about a 98% blockage, was it?
Yes, he
in
had
that major artery.
Right, it's called the LAD, left anterior descending artery. It was a, you know, God forbid, if you had had a heart attack, it would have been 40% without attention. You can die from it.
All right, and it was that same artery that caused concern, and you said this does happen sometimes where you have stenosis in that vein.
Yes, you can get something called restenosis, which is reblocking of the artery or the stent. Although the reblocking happens usually in the first 6 months, but some of them do happen later. And my concern was when Bruce came that he was having some chest discomfort that's recurrent, chest pressure. That's the word we don't want to hear, chest pressure. So I was very concerned, and we did a stress test, and I wasn't 100% sure. So I said, I want to do a minimally invasive cardiac catheterization. So this way we can be absolutely sure there is nothing significant that's going to cause him a heart attack.
And, you know, we do these stories and we talk about these procedures, and we don't want to scare people because in this case, actually, you were able to go in and do nothing. So, I mean, this could have been life-saving for him again, but now he can breathe a sigh of relief knowing that that artery is okay.
Absolutely. It's a weight off your chest, you know. Once you do the cardiac catheterization, now we can do it minimally invasive from the radial arteries. Sometimes we do it from the groin artery, sometimes from the brachial. It's only minimally an IV. And I tell you, 8 out of 10 of my patients, I don't even give them sedation, just local anesthetic, and I talk to them throughout the whole procedure. And you can do the cardiac catheterization, you know, nothing without its risk. It's minimal risk, however, once you get the answer, you know, it's
huge. It's a huge burden off your back. All right, we want to bring in Bruce now because we've been talking about him all morning long. And this guy is a friend of yours now. Clearly, he has had a major impact in your life. And Dr. Ashi, you have challenged Bruce to make some changes in his life. Talk about that.
Well, look, his fat sitting this way.
Stop it.
Well, it's very important to, you know, make risk modification. You know, we're talking about exercise, diet, taking the medication, but I can tell you one of the most important things is to adopt an aerobic type exercise, by 30 minutes, 45 minutes a day. Some people say 5 days a week. I believe that really exercise is 7 days a week. And it's very, very important to adopt exercise, diet. And I always tell my patients, if I had coronary disease or vascular disease, I would become a vegetarian immediately, because
this is a man who doesn't love vegetables.
To be honest with you, that's no, Jen's going to, that's a challenge for me because I'm not a big fish eater and I'm not a big vegetable eater. But I really do have to adopt more of a Mediterranean approach, I guess, to my foods.
Absolutely. And it's very difficult to become a vegetarian. But however, you know, knowing the consequences of peripheral vascular disease and coronary disease, I know that, you know, adopting a very strict diet and a strict exercise is better than any procedure I can make or the surgeons can do. So exercise and diet is very important. Taking the aspirin, you know, taking the Plavix that we prescribe for the stents are very important, especially in the first year. And the cholesterol medication is very important.
All right, Bruce, you're looking very serious right now. Does that mean you are going to adopt this lifestyle?
She's making me.
I really am. I mean, I'm dead serious about this. We're going to be holding you accountable.
Dr. Ashi has talked to me about it at great length, too.
All right. So, Bruce, the next month is going to make some changes, and we are going to document it and watch it because we do want you here and we want you healthy. All right, Jen, Dr. Ashi, thanks for coming in.
Thank you so much.
All right, over to you. Knowing how to read your blood pressure, it is so important. And during our big Take It to Heart event this year, a lot of people went to the hospital, and it was because of those numbers. They were dangerously high. In fact, we had 9 people that got sent straight to the emergency room. So joining me now to explain what is normal and what is not, Michelle Burt with Walgreens. Appreciate you coming in today.
Oh, my pleasure.
And you know, you've done this now for 2 years. I've done it for almost 10 years. And you know, every year you have people who, I mean, blood pressure off the charts that it's almost unbelievable.
That is the case, and that's what we saw with this last event. We had 3 patients. We had one that was 230 over 120. Then we had someone 196 over 160. And then we had somebody else 212 over 160. All those are dangerously high numbers.
And you remember them because they
yes,
for you.
They were just rather pronounced. That
now,
is
if you
correct.
if you don't know what that means, and you're sitting there, you're like, oh, numbers are numbers. Let's put up a graphic that we have for you that kind of explains where those numbers should be. And as those numbers you said, I mean, some of those people are hypertensive
They're in
too.
stage 2.
Yeah.
That is correct.